guys, this is nurse practitioner Britney Jackson at Jackson Health and Wellness Clinic, coming to you today with a hot topic of weight loss, specifically weight loss injections. They are all over social media. We are getting calls and DMs and messages daily about these medications, so let's dive into it. Specifically, the weight loss injections that most people are referring to are Saxenda and Wegovy. These medications belong to a class of drugs called GLP-1s that were originally designed to be diabetic medications. They found they help people significantly lose weight, so now we have two versions that are specifically meant to treat obesity instead of diabetes. The drug, the class of GLP-1 agonists, mimics a hormone in the body called glucagon-like peptide 1, hence the name GLP-1. In diabetic patients, it triggers the production of insulin, which is what helps to lower their blood sugar. This medication also affects a portion of the brain called the hypothalamus, which helps to curb your appetite and curb your cravings. It also affects part of your stomach, which leads to delayed gastric emptying, which helps you to feel fuller faster and stay fuller longer. Therefore, you're eating less. Who can take these medications? This is where we get into the controversial part, all right? So you can have these medicines for weight loss if your BMI, which is a calculation that we look at called your body mass index, looks at your height and weight. If your BMI is 30 or higher, or if your BMI is 27 or higher and you have some form of a comorbid condition like high blood pressure, high cholesterol, those are the people that these medications are meant to treat. Again, there are only two that are specifically for weight loss, and that is Wegovy and Saxenda. Like I said, these were originally designed to be diabetic medications. Therefore, we have several that are meant to treat type 2 diabetes. And that would be medications like Mounjaro, Ozempic, Rybelsus, Trulicity, Victoza. These medicines are only for type 2 diabetics. You do not have type 2 diabetes, you cannot have any of those medications. Don't ask me because I'm not going to give them to you, okay? Wegovy and Saxenda are the only versions that are available for weight loss. Insurances are cracking down on this really bad right now. Even if we try to get you Mounjaro, for example, and you do not have a diagnosis of type 2 diabetes, your insurance is not going to approve it. I've also seen some insurance companies coming after providers and pharmacies who are giving these medications to patients who are not diabetic. So I love you, but you can't have it, okay? We are also seeing some supply issues with these medications, particularly with Wegovy. The 3 lower doses we're having a really hard time getting right now because the demand is so high they cannot meet the supply. We are also seeing, similarly in the diabetic realm, now some of those medications are becoming difficult to get because there are providers out there who are writing them for patients who are not diabetics. Listen to me. It is not right for a patient who wants to lose 10 to 15 pounds, who doesn't have a diagnosis of diabetes, to take a medication from a person who is diabetic that needs that medication to live, okay? So we do not want to use the diabetic versions in patients who are using these drugs for weight loss. I'll get off my soapbox now, okay? You also cannot have these drugs if you are pregnant or breastfeeding because there's just not enough research to show how it's going to affect you or the baby, so you just can't have it. You also, if you have a personal or family history of medullary thyroid cancer of multiple endocrine neoplasia, that's a mouthful. If you don't know what it is, you probably don't have it in your family, so I wouldn't worry too much about it, okay? You also want to be careful in people who have a history of pancreatitis or gallbladder attacks, as this can cause some of those issues for patients. So make sure that you make your provider aware that you've had those problems in the past. The most common side effects we deal with are GI side effects, nausea being number 1. You can also have indigestion, diarrhea, constipation. Some people have experienced dizziness, headache, fatigue. I will tell you, for most patients, it has not been severe enough for them to stop the medication. How much weight can you expect to lose on these medicines? Well, according to the research, After 1 year of treatment, Saxenda is around 21 pounds, or about 6.4% decrease in body weight. And Wegovy is around 33 pounds, which is about 15% decrease in body weight. However, these drugs are not miracle drugs, okay? You still have to do the work. You have to drink the stupid water. You have to change your nutrition. You have to exercise. You have to get enough sleep, and you have to cut your stress. You cannot stay on these medications forever, contrary to what I have seen some people say on social media. You can't stay on them forever. So you're gonna have to come off them at some point. So if you're not doing these things, number one, you're not gonna lose as much weight as you want to. And number two, you're going to put the weight back on whenever you stop the medicine. The medication is just a tool to help you lose weight. We are changing your lifestyle. This is a lifestyle change, not a diet. It is a marathon, not a sprint. We are creating a change so that you can lose weight and you can keep it off, okay? Really, really important that you realize that there is no quick fix. I'm so sorry for weight loss. There's just not. You have to put in the work, okay? If you do not qualify for Saxenda or Wegovy, there are some other medications that we can use, or we have several patients we're just working with them on nutrition, exercise, sleep, and accountability, which is what a lot of us need. Want to know if you qualify? Give us a call, 270-629-6722. You can check us out on social media. We are on Facebook, Instagram, and TikTok, or you can reach us through our website, jacksonhealthandwellness.com. Again, this is nurse practitioner Britney Jackson, Jackson Health and Wellness Clinic, hoping you have a great day.